on to our fourth presenter today. I'd like to invite Abdullah Albeyatti to the stage. He is from Medicalchain.
Hello, good afternoon, everybody. Use this as
Stay close.
Okay. So, my name is Abdullah Albeyatti. I am the CEO and co-founder of Medicalchain. I'm also a doctor in the National Health Service in the United Kingdom, and I'm here today to talk to you about, of course, Medicalchain. So, Medicalchain is a platform for the storage and utilization of electronic health records using blockchain technology. Now, the term blockchain might be new to some of you in this room. If I mention the word Bitcoin, that's something what you might be more familiar with is Bitcoin, and the spine of Bitcoin, the foundation of Bitcoin is blockchain technology. Blockchain technology is set to revolutionize the way that we handle data in terms of its storage and utilization and the way that we would share this data as well. So what we want to do is empower patients to be the center of their own health record management. We believe that patients should be holding onto their own health records so that they don't have to rely on the different institutions and different hospitals they might go visit. In today's world, we carry our photos, our videos, our emails, we even have our banking services on our mobile devices, but we still are not able to hold on to our own medical records. Using Medicalchain, patients will be the owners of their own medical records and control their own records, which is their asset and is personal to them themselves. And this is what we are targeting, and this is what we are doing at the moment at Medicalchain. Medicalchain also solves some other problems. With blockchain technology, you're able to deliver a decentralized, trustless, incorruptible system, which goes hand in hand with what we need in terms of handling data or medical data. We also focus on these 4 points here as well, which Medicalchain solves the problems for these. So these are 4 examples that people may be familiar with. So in terms of security and fraud, if you have all your data stored on a single server and that server is hacked, that's what's happened in previous cases. Whereas with blockchain technology, the information is decentralized, and that way we share all these ledgers between us. And even if something is corrupted, it doesn't destroy the other records, and we can continue using that data as reliable. In terms of data storage, handling, it can never be deleted and it can never be edited. So you don't have cases where we had within the NHS, we lost 700,000 patient records recently. And in terms of interoperability, this is a running theme that we had today, this morning, about everybody holding on to different silos of information and there not being a single version of the truth. With blockchain technology, when you have our platform Medicalchain, you will hold all of your medical records in one place. The consultation will not go where you'd come see me, a doctor, and I would look on the computer and find your records. You would come to me with your records. So we're always using one platform, one system, which holds all of your data. And then finally is privacy control, which I think is the most important thing and a value which we all share in this room. You will have complete control over your data again. So you will be able to grant access and revoke access to whoever views that data. So that empowers the patient and puts the patient at the center of their own consultation and their own healthcare journey. So if you wanted to share your information with pharma, you could share your information with pharma. You're not having a hospital or institution making that decision on your behalf. If that pharma company wanted to incentivize you because they're doing research on your particular demographic, you could arrange that with them. Same with insurance. So if I use an example of driving a vehicle, in the United Kingdom, we have a black box now. If you put it within your vehicle, then they offer you a better premium because you're showing transparency in the way that you're driving your vehicle. It's the same with your medical records. If you communicate directly with insurance companies and you are transparent with them about your medical records, then they are going to offer you a better premium. A lot of people are unknowingly, and unfortunately in some cases knowingly, not sharing their health records accurately, and that's leading to people being underinsured. So this is another key area that we are trying to solve at Medicalchain. And in case anybody's skeptical about blockchain technology, these are some names that might be familiar with yourselves. This is what's happening in the fintech world. In terms of countries, the Netherlands, UAE, essentially all of Estonia's government is built on blockchain technology now in their information technology. In Switzerland, you can pay for your council tax, and there's now land registry, which is all being regulated through blockchain technology as well. It really is a shame when I see so many amazing individuals, when we've heard so many fantastic talks, that as a health industry, we're always the last ones to get on board with this innovation. We're not creating something new here, we're just joining the dots and using this kind of new technology, which we strongly believe is the way forward in future as well. And I'd like to just say that as a startup, we are welcoming feedback from everybody, from patients, clinicians, investors, pharma. So please get in touch with ourselves as well, so we can continue this conversation and we can continue to have great collaborations with everybody else. Thank you very much.